Joining us is Dr. Elizabeth Hammershaimb, infectious disease pediatrician at the University of Maryland Children's Hospital and assistant professor of pediatrics at the University of Maryland School of Medicine. Doctor, thank you so much for joining us. I'm hearing so many people, even in the office today, coughing and sneezing. From what you're seeing in your work, what's going around right now?
There are a lot of different things going on around right now. We're seeing a lot of influenza. RSV is still around, although it looks like we might be over the hump there. COVID, fortunately, is on the decline, and levels of that aren't as high, but there are lots of other respiratory viruses out there that circulate year-round, but especially in the winter when people are cooped up indoors.
How do you know, well, we'll do the pediatrics perspective on this, when it's your child who has clearly picked up some respiratory something, how do you know what it is and how seriously you should take it?
That can be really tough. With other respiratory viruses, we don't typically keep children home from school or daycare unless they're having a fever or they're having difficulty breathing or tolerating their food or drink. We used to just let them go and, if they have a runny nose, they have a runny nose. But nowadays, people are a little bit more careful. If they are having any of those symptoms, it would be wise to test them for COVID or even flu, since those have different measures that we take in terms of isolating and sending kids home.
And in terms of what's happening with COVID, what I've been reading in the regular press is that it's out there, and we always get this bump in January after the holidays. And we're getting it, but less of a bump in terms of the number of people hospitalized. And maybe it's because they had some immunity or the vaccines or they had it, but maybe it's a little bit milder at the moment. Could that be?
That's right. There are also lower levels of COVID circulating, and we know this from our wastewater testing, which has been so helpful in figuring out just how widespread COVID is these days.
How about the flu? For people who maybe stopped regularly getting a flu shot because there's so many other vaccines being promoted at the moment, is it too late to get a flu shot? And from the level of flu that you're seeing, does it seem to be a good idea?
It's certainly not too late to get a flu shot. Every year we see different spikes. Right now we're in the middle of a spike of flu A, and flu A is still rising. So we're not over the hump with flu A yet. And we expect to see flu B in another month or so. So the vaccine contains vaccine strains for both flu A and flu B. And so if you're thinking about it, now's a great time to go out and get that shot.
A lot of news coverage about bird flu. We've had some chicken flocks on the eastern shore of Maryland that have been affected by this. We're not seeing that in people yet. Maybe a couple isolated cases not here. Is that correct?
That's correct. To my knowledge, there hasn't been a case in Maryland yet, but we're on the lookout. And if patients come into the hospital with flu and we don't know exactly which flu it is, we need to consider bird flu as a possibility.
How do you protect a daycare center? How do you protect a school or your house? I guess none of those things are possible. But what can you do as a parent or grandparent to be as resistant as you can about things spreading around your environment?
That's a great question. A lot of the things we did for COVID work for a lot of these respiratory illnesses, including flu. But one of the things that's ripping through daycares and families right now is norovirus. And that's sometimes called stomach flu. And unfortunately, the things we did for COVID don't necessarily work for norovirus. Hand sanitizer is not sufficient. The regular disinfectants we used for COVID and flu is not sufficient. So people need to be vigilant and return to those age-old precautions like washing your hands with soap and water and using bleach to decontaminate areas that get soiled.
We really need like an Apollo project, a Manhattan project to come up with a hand sanitizer that actually works on norovirus. But washing your hands old school does work.
Yes, it does. It works better.
You know, so many kids deal with asthma. If you come down with certainly the flu, COVID, and so forth, but even the common cold, which I think is a rhinovirus, which sounds worse than the common cold. How does that interact with somebody who has a problem with asthma?
People who have asthma are more susceptible to airway inflammation. And when you get a viral infection, that can really tip off a cascade. For most kids who have the common cold, even those who need to be hospitalized, we don't necessarily use steroids. But in a child with asthma, or even an adult with asthma, it's important to be cognizant that steroids can actually be very helpful. And so it's important to let your healthcare team know that you have a history of asthma, but also to not wait until you're really incredibly sick and go see your doctor, go get some medical attention, because there may be things to do to treat your asthma in the short term while you get over the virus.
Tell me about the clinical trial you're working on, something called enterovirus, if I'm saying that right.
Yes. So rhinovirus and enterovirus are actually in the same family of viruses, and there are hundreds of them. The most serious ones cause polio. The least serious ones cause the common cold. There are two that cause pretty severe disease that's not quite polio, and one of those is called enterovirus D68. It causes a polio-like illness in children, and we're not sure why, but we've found a monoclonal antibody that we hope will work against it. And so this fall, we enrolled participants in a first-in-human trial to evaluate that antibody.
Monoclonal antibody sounds fancy. What is that?
So when the body meets some kind of infection, it generates antibodies, and they may have slight differences in them. Monoclonal antibodies are ones that we purify in the lab so that they're all the same.
All right, and in the minute we have left, let's review for parents and grandparents who are watching. What do you want them to know? What should they be on the lookout for? And what can they do to make sure that the kids who start sneezing and so forth get better quickly?
The big things, aside from washing hands, that I like to remind people at this time of year is that kids really need to learn to cover their coughs and their sneezes. I think when people were masking a lot, it got easy to just rely on the mask to contain your sneeze or your cough. And so people need to return to some of those old practices. And the other things that I would say are to make sure that you don't get dehydrated, whether it's a GI bug or whether it's a respiratory illness with fever. It can be easy to get dehydrated. And so if someone's not tolerating their water or fluids, that should be something to really set off a red flag.
Very good. Dr. Elizabeth Hammershaimb, University of Maryland Children's Hospital. We appreciate your time. Thank you very much.
You're welcome.